You have been sold the dream of super immunity, but what if the strongest studies say those shots and gummies barely move the needle and your money is better spent on sleep and soap? In this video, we test this big promise against real evidence in a friendly, no-drama way you can use. We will follow what careful reviews and major health agencies actually found. This video is for education only, not medical advice. Stay to the end for a bonus checklist that can save you time and money. Let us start by asking what these products truly promise compared with what real life needs. Boost your immunity sounds powerful and safe, but according to a major Cochrane review, most over-the-counter products show small or no benefit in well-nourished people. When we compare supplements with basics, guidance from the Centers for Disease Control and Prevention says sleep vaccination and hand washing reduce infections more than pills. This video will show what works, what does not, and what might help in special cases. According to a Cochrane review on vitamin C and the common cold, routine daily vitamin C does not prevent colds in most healthy adults. A paper published in the BMC Public Health journal reports that steady daily vitamin C can slightly shorten a cold and make symptoms a bit milder. The same Cochrane review explains that starting vitamin C only after symptoms begin has not shown reliable benefits in solid trials. So vitamin C is not a shield, but as daily background it can shave off a little time and discomfort for some people. If dose matters for vitamin C, who actually sees the benefit and how much is used in trials? The Cochrane review notes many trials used 1 to 2 grams per day, and too little often showed no effect. The review also reports bigger effects in children and in people under heavy physical stress, like endurance athletes. Side effects are usually mild, but high intakes can cause stomach upset and, rarely, kidney stones, according to safety notes in Cochrane analyses. If you choose vitamin C, steady moderate dosing makes more sense than chasing symptoms late. Another common remedy is zinc. And for zinc, form and timing are everything. A recent Cochrane review on zinc found that zinc lozenges, not standard pills, can shorten a cold by about 1 to 2 days if started within the first 24 hours of symptoms. The same review highlights that some lozenges, such as zinc acetate types, performed better than others. For safety, the United States Food and Drug Administration has warned that intranasal zinc sprays were linked to loss of smell, so avoid products used inside the nose. If you use zinc, use lozenges, start early, and stop if side effects like nausea become a problem. Many people also ask about vitamin D, so let us separate deficiency care from megadose myths. A large analysis in the Lancet Diabetes and Endocrinology journal reports no clear overall prevention of colds or flu in well-nourished adults taking routine vitamin D. Any small benefit appears mainly in people who are truly deficient, and daily or weekly, moderate dosing looks more reasonable than rare high-bolus doses, according to the same journal. For COVID-19, a randomized trial in the JAMA journal that used a single high dose in hospitalized patients showed no improvement in outcomes. Ask for a blood test if you have risk factors for low vitamin D and treat proven deficiency rather than megadosing just in case. Herbal products are also everywhere, so what do careful reviews say about echinacea and elderberry? A Cochrane review concluded that echinacea shows no consistent prevention or treatment effect when you add up better quality trials. A systematic review in the BMC Complementary Medicine and Therapies journal suggests elderberry might slightly shorten symptoms, but many trials are small and vary in dose and preparation. Because herbal products are not standardized like medicines, different extracts can act differently, which helps explain why some trials are positive and others are not. Short-term use appears safe for most adults, but people who are pregnant or breastfeeding should speak with a clinician because safety data are limited. Gut health is another hot topic, so what about probiotics for colds? A Cochrane review on probiotics for upper respiratory infections finds that certain strains can slightly reduce the chance of getting at least one cold and may shorten illness by about 1 day. Benefits are modest and depend on the strain, the dose, and the age group as emphasized by Cochrane authors. Side effects are usually mild, like gas or bloating, but people with severe immune problems should avoid live probiotics because rare infections have been reported in fragile patients. If you try probiotics, match the strain and dose used in studies, and set expectations low. Many people still ask about multivitamins and immune blends. So here is what careful summaries show. Systematic reviews summarized in the European Journal of Clinical Nutrition show that in well-fed adults, multivitamins and immune packs do not consistently reduce infections or sick days. Some benefits appear in older adults or people with poor diets, which means fixing real nutrient gaps can help, but that is different from boosting an already adequate system. Because vitamins A and D are fat-soluble, the Cochrane Collaboration and Nutrition Guidance warn against megadoses without medical oversight. If you like clear, no-hype breakdowns like this, please subscribe so you will not miss our next evidence deep dive. Energy shots and clinics push vitamin B12 injections. So what does the research say? A research synthesis in the Nutrients Journal reports that vitamin B12 injections do not improve fatigue, mood, or thinking in people who are not deficient, and there is no evidence they boost immunity. Clinically, vitamin B12 shots are for true deficiency or malabsorption, which a clinician confirms with blood tests, as discussed in the Nutrients Journal. Routine shots will not stop colds or flu in otherwise healthy people, and dollars go further when spent on basics like sleep and food quality, a point also reflected in guidance from the Centers for Disease Control and Prevention. From shots to drips, let us look at intravenous vitamins and glutathione. There are no randomized controlled trials in the JAMA journal or the Lancet family of journals showing that intravenous vitamin drips or intravenous glutathione prevent colds or flu. Intravenous lines carry infection and allergy risks, and public health bodies caution that elective intravenous treatments are not standardized like prescription drugs. Some national alerts have linked cosmetic glutathione drips with serious reactions, which strengthens the case to avoid them unless medically indicated. When the benefits are uncertain and the risks and costs are real, evidence points you back to proven basics. Small trials discussed in the European Journal of Clinical Nutrition suggest certain yeast or mushroom beta-glucans may reduce days with cold symptoms in athletes or highly stressed people, but effects are limited and often industry-funded. A meta-analysis in the BMC Sports Medicine Journal found that bovine colostrum reduced days with cold-like symptoms in athletes, but there is little evidence for the general public. These are niche findings with modest size, not proof of broad superimmunity, according to those journals. If you experiment, monitor cost and watch for quality seals, and keep expectations realistic. Garlic and ginseng also get attention, so how do they hold up under scrutiny? A Cochrane review on garlic found that evidence is insufficient to say it prevents the common cold because trials are small and vary in quality. A review in the Evidence-Based Complementary and Alternative Medicine Journal reported inconsistent results for North American and Asian ginseng in healthy adults. Both reviews warn about product quality and potential drug interactions, reminding us that herbs are not standardized like prescription medicines. Use caution, especially if you take blood thinners or have chronic conditions. You might wonder why studies keep disagreeing, so let us decode the patterns. Cochrane reviewers explain that dose matters. For example, 1 to 2 grams per day of vitamin C shows a small effect, while very low doses often show none. Formulation matters. Zinc acetate lozenges often perform better than standard tablets in some trials, according to the Cochrane Review on Zinc. Population matters. The Lancet Diabetes and Endocrinology journal notes, vitamin D helps most when true deficiency exists, not when levels are already fine. Once you account for dose, form, and who was studied, the mixed headlines make more sense. With patterns clear, safety and interactions become the next smart step. Cochrane sources and clinical references remind us that zinc can bind to tetracycline and quinolone antibiotics, so separate the doses by a few hours to avoid blocking absorption. Because vitamins A and D are fat-soluble, megadoses can build up and cause toxicity, which is why nutrition guidance and Cochrane reviews warn against very high doses without medical advice. The United States Food and Drug Administration has warned that intranasal zinc products were linked to loss of smell, so if you use zinc, choose oral lozenges and avoid the nose. A simple safety-first mindset protects your health and your wallet. Some groups need extra caution, so let us cover who should be careful. Cochrane Reviews and clinical guidance advise that people who are pregnant or breastfeeding should be cautious with herbs because safety data are limited and strengths vary. Those with autoimmune conditions should be careful with immune-stimulating herbs like echinacea, since the risk of flares is not fully ruled out in high-quality trials. People with severe immune suppression should avoid live probiotics because rare infections have been reported in fragile patients, a point emphasized by Cochrane authors. When in doubt, ask your clinician before starting a supplement. If not pills, then what actually works in the real world? The Centers for Disease Control and Prevention points out that sleep, vaccination, and hand washing are the heavy hitters for real-world protection. Training from the Centers for Disease Control and Prevention on sleep and immunity shows that short sleep can weaken vaccine responses, which is a big and measurable effect. A balanced diet, regular physical activity, and stress management round out the core pillars, as noted by public health guidance and nutrition research in the European Journal of Clinical Nutrition. Put your time and dollars where returns are proven. You waited for practical steps, so here is your bonus checklist. Pick one simple product over long stacks, because the Cochrane collaboration notes complex mixes are rarely tested as a whole. Look for third-party quality seals such as USP or NSF, and be skeptical of miracle claims. The United States Food and Drug Administration says supplements cannot legally claim to prevent or cure disease. Compare cost with likely benefit. If a zinc lozenge might save about 1 day of symptoms, that can be reasonable. But an expensive intravenous drip with no randomized trial support is hard to justify. Keep receipts, track how you feel, and reassess after a season. Let us wrap with a clear and empowering summary you can act on today. No supplement gives super immunity, and that is the shared message from Cochrane Reviews, the JAMA Journal, the Lancet Diabetes and Endocrinology Journal, and the Centers for Disease Control and Prevention. Vitamin C can slightly shorten colds with steady daily use. Zinc lozenges can help if started early, and vitamin D makes sense when a blood test confirms deficiency. The most powerful protectors are still sleep, vaccination, hand washing, food quality, movement, and stress control. This video is for education only and not medical advice. Please speak with your clinician for personal guidance. If you want more clear, science-first videos, comment the next topic you want us to tackle and consider subscribing so we can keep turning good evidence into everyday wins.